Genetic testing in isolation is limited in what it can offer. You really need the full cardiovascular genetics evaluation, and that's really a team-based evaluation that involves genetic counselors like me, but it also involves both adult and pediatric cardiologists who specialize in inherited heart disease, advanced practice nurses who have expertise in inherited heart disease and helping families deal with them, and for young sudden death, very often a psychologist as well. And the reason why that whole team-based evaluation is needed is because we need the cardiologist to look carefully at all of the medical records and the tests to look for a clue. We need the genetic counselors to choose the right person to do the genetic test on, to interpret the genetic test appropriately, to comb through the family history, especially in sudden death families. We can spend an hour taking the family history and then months with the family trying to get medical records, talk to other family members, talk to great aunt so-and-so. All of those different clues have to be in place to try and get the right answer. And that's just making the evaluation. Then there's helping the family understand it, helping the family implement the recommendations, helping the family cope and grieve. We know from work done by my colleague Jody Ingalls that these families have something like PTSD, and they have very complicated, prolonged grief. So they need special care for that a genetic test obviously can't provide. So genetic testing is just a tool that we use within the cardiovascular genetics evaluation. And sometimes it's a very helpful tool, sometimes it doesn't help us at all, but you really need all the other tools and all the other puzzle pieces and the right team to put the puzzle together. Oh, there's so much more to be done. So first of all, we need a lot more genetic counselors in cardiology, and that is happening rapidly. I mean, when I started doing genetic counseling in cardiology, there were probably 6 or 7 of us in the country, and now there are hundreds, which is great, and it's expanding very rapidly. In addition to that, we're kind of the number of cases or situations or diseases where a genetics evaluation, including genetic counseling, genetic testing, team-based care is indicated, is increasing as our understanding of the genetic basis of disease and our available genetic tests increases. The first thing is you have to be aware of it. And our field is growing very, very fast. So I think more people in the high school and college are becoming aware of this as a career option. So once you become aware of it, you then go to graduate school. It's master's level training. It's specific to genetic counseling, so you get a master's degree that is in genetic counseling and has coursework in medical genetics, molecular genetics, but also counseling theory. So we're sort of this combination of genetic and medical expertise as well as psychological counseling skills. And then after you're finished your master's, you're ready to pass your boards and go out and practice. We're not physicians, we're allied health professionals trained with a specific master's degree. It's growing rapidly. So I think there are between 30 and 40 programs in the US, and every year we're adding more. We're really at an inflection point for genetic counseling where the profession is just exploding because of genomic medicine really exploding across all areas of medicine, not just cardiology. And in response to that explosion, the profession of genetic counseling is increasing its capacity for training genetic counselors so that we'll have more genetic counselors out there in the field. So it's growing really quick, and the number of programs and the number of students per program is growing very rapidly. Families who have lost someone suddenly young, I mean, there's the intellectual challenge of having to keep abreast of a quickly moving field, of trying to interpret ambiguous genetic test results. There's all of that, but what far trumps that is the heartache of seeing a family lose an otherwise healthy young person. And the really hardest cases are when 2 children have died suddenly, because when the first child died suddenly, they didn't get the right care, and we could have prevented that second sudden death if they had gotten the right care. And seeing the pain and turmoil that those families experience and guiding them through that is heavy and very hard work. But I also feel very privileged to do it because you're able to help meet a very real need. Probably the same thing. I mean, being able to help someone who has a scary, rare situation, a heart condition in their family, or someone who's died suddenly, they're worried about themselves, they're worried about their kids, they go try and seek care maybe with a general cardiologist or their pediatrician, who could be a phenomenal doctor, but these are very rare diseases and they just don't have the right expertise. And then they come into a center like ours where we have a whole team of people with complementary expertise, and they get the experience of finally meeting someone who knows their disease really well, understands what they need, and has the pieces in place to meet those needs. That's incredibly satisfying.